Joining me now is Nicolas Hulscher. He is an epidemiologist and administrator at the McCullough Foundation. Pretty important. Nicolas, good to have you on the program. This is an incredible study. Share with the folks what you found so far.
Yeah, well, thanks for having me. And yeah, this study is absolutely groundbreaking. In fact, it's the largest human cancer study with these anti-parasitics. So what we had about 200 cancer patients prescribed ivermectin and mebendazole compounded capsules through the wellness company telemedicine platform. We followed them for about 6 months, did a follow-up survey. After those 6 months, 84.4% of the cancer patients reported to have benefited from the ivermectin and mebendazole in their cancer. Particularly, about half reported either cancer disappearance or tumor regression, tumor shrinkage, and about 36% reported to have their cancers stabilized. So that is a 84.4% clinical benefit ratio, absolutely huge.
Yeah, it's remarkable. Look, medications are often used off-label. That's what be called here for ivermectin and mebendazole. It's used for parasites like river blindness and so forth in Africa. It's been used since the 1980s, won the Pulitzer Prize. It's not a horse dewormer, as the people on the left tried to convince you during COVID. It's an effective, time-tested, and proven medication that now has other applications potentially. Where do you go from here? Is there a next study? I mean, 84% is a remarkable number, but you have 200 patients in this study. What's next?
Next is larger sample sizes, which we plan to do, maybe 400, 600, even 1,000 patients with even longer follow-up, up to a year, to confirm this 84.4% clinical benefit ratio. But also what's next now and what's needed is large-scale, double-blind, randomized, placebo-controlled trials to confirm therapeutic efficacy. We're aware of some initiatives currently underway to do this, and we're very hopeful that it will happen, particularly and maybe in Florida. Yeah.
Look, I want to go through this a little bit because I mentioned it, but I want to make sure that I'm clear on the relationship on the way that a tumor functions inside the body and a parasite functions inside the body, because this is where the intersection is, right? Here's where the intersection, this is why ivermectin and mebendazole have efficacy, is because these two afflictions, if you will, operate in fairly similar fashion. Tell the folks.
Yeah, well, actually, there's over 100 preclinical studies, so laboratory and in the animals, of ivermectin, mebendazole, fenbendazole, and cancer. Those 100 studies, over 100 studies, have found there are over 12 distinct anti-cancer mechanisms across more than 12 cancer types with these anti-parasitic compounds. And there's three key ones. One is ivermectin targets cancer stem cells. Chemo does not get rid of those. Those are the source of some of these cancers that keep them, they basically cause reoccurrence of cancers, even if you appear to eliminate them. So you want to get rid of those. Ivermectin appears to in the laboratory studies. It also, mebendazole disrupts what's called microtubules. This is critical for cell division in cancer cells. So you cut that off, these cancer cells will have a hard time to divide. And mebendazole also inhibits glucose metabolism in cancer cells, which cancers love to feed on glucose. They love sugar. You cut off their ability to uptake the sugar, they're going to have a hard time to propagate in the body. So we have very promising preclinical mechanisms explaining why we saw such a positive clinical benefit ratio in the human data.
What do you think, Nicolas, that all these big pharmaceutical companies that do all of their studies would have stumbled across these facts a long time ago and have known this and could have saved a lot of folks, but why wouldn't they do it? I mean, how much does cancer treatment cost compared to ivermectin? I guess that'd be I'm a little jaded here, but it seems to me these big pharmaceutical companies would have stumbled across these facts a long time ago before these studies were done, and yet they never shared that information if they found it. Why do you think that would be?
Not profitable and not patentable. Very cheap compounds. It could cost just a few grand a year to take ivermectin and mebendazole. Chemo, on the other hand, a study found over about a year, patients can spend over $100,000 on chemotherapy. And so, it's not profitable for the pharmaceutical companies to advocate for compounds that cannot be patented or profited upon.
Yeah, and there it is. I'm a little jaded, Nicolas, but I'm on the money. Nicolas Hulscher, thank you for being here today. We'll continue to dig into this study and look for more to come, but it is incredibly enlightening. Thank you.
Thank you.